Hello, my name is Sarah Anderson. I have been with Fresenius for 1 year and have loved working with the staff and providing the best level of care I can for our patients. I appreciate each of you for coming to hear some solutions I would like to propose in response to a very critical area I have noted within our facility. As I have observed over these past few months, I would be remiss if I did not step up to provide leadership among my peers to offer my assistance in addressing the nursing shortage. As a patient care technician, my responsibilities, as are all PCTs, can be quite demanding. However, the nurses who are in charge to carry out even more demanding roles than mine can become quite overwhelming. So, as a result, I have called each of you here to offer some solution. By the end of this presentation, each of you will understand, 1, what are the contributing factors of nursing shortage in our medical facility, why are nurses leaving and deciding not to do nursing anymore. In the study conducted by DOSE 2017, he noted that 30% of nephrology nurses were 60 years and older. Only 34% were 20 to 40 years old. We want to explore the reasons for this shortage. 2, what proposed solutions are being put forth to address the shortage along with relevant research. You will grasp the implementation details and the plans to evaluate the effectiveness of the solution. Nurse shortage is an issue that has been existing for many of years. Emerson, 2016, as I noted earlier, suggested that the nursing is a shortage occupation in general. The American Nephrology Nurses Association summons members of the renal community together to address the shortage among nephrology nurses. Newman, 2018, noted that there are predictions of further reduction in the nephrology workforce that present serious implications for the care of future dialysis patients. Osman ascertained the nephrology workforce is critical to meet the growing worldwide burden of kidney disease. Fresenius medical care staff participated in short surveys so the nurse shortage issue could be understood. As a result of the responses, the staff believed that the major contributing factors to nurse shortage of the facility could include workload burnout, too many workers from the many patients, low morale due to work trauma brought on by mistakes with patients, patient care technicians frequently calling off of work without advance notice, and poor executive management. As you will note, 25% of those surveyed believe that workload burnout and inadequate management are the highest categories to the shortage. Because of these two, nurses are deciding to leave the profession sooner than planned. They would rather take lower paid jobs than to deal with the daily stress of their current nursing work. What can be done to address the problems? So what can we do as an organization to address the nursing shortage? Each organization is different, and here at Fresenius, we set up the standard for renal care. I believe working together, we can address our nurse shortage. It involves teamwork, clear communication, patience, and trust in each other. Each of us in this room has to roll our sleeves up, come together to get it done. Together, we can do this. In some states such as Georgia, Maryland, and Massachusetts, there are mandated staff ratios at dialysis centers, according to Rastogi and Chartow 2018. Although it is not a part of our solution proposed at this time, I mention it because it is something that may need to be considered in the future. As for our organization, I want to offer 3 solutions we can implement to address our nursing shortage crisis. 1, we can train our patient care technicians to do more of the nurses' work. 2, in order to acknowledge the larger and small successes, nurses and patient care technicians and incentivizing programs should be put in place. 3, we must revisit company policies regarding employees calling off of work. Who do we need to get started? The implementation of these proposed solutions will not happen if each of you represented in this room do not participate. The reasons you were asked to be here is because there is value that you bring that make us the standard in the renal care industry in the city of Chicago and in the state of Illinois. The executive team, which includes human resources, finances, and operation department, your role is vital to the success of all we are hoping to accomplish through this proposal. The buy-in is solicited, and I am hoping that you will see the merit in what I am proposing. I believe implementing these solutions will 1, save us money, 2, increase customer satisfaction, and 3, increase employment morale and workplace satisfaction. 4, increase among employees, and 5, a more defined process for employees calling off work. Dialysis patients spend approximately $72,000 per year. So that means we cannot afford to make mistakes that can cost them their lives or cause us to end up in court because of them. If we take this opportunity to address the concerns of our nurses, then we can ensure a win for all of us in the end. So, how will we get it done? We will need resources in order to make this work. The various pieces of the puzzle must be brought together in order to make this a successful venture. 1, money is needed to purchase a new or enhance our current training curriculum that will be used to enrich the knowledge of the patient's care technician, who will assume some of the work of the nephrology nurses. 2, time is needed to implement these solutions successfully. This program will be implemented as a 1-year pilot, after which this team will come back together to discuss the effectiveness. And lastly, technology is always needed to communicate a systematic fashion to encourage teamwork amongst all staff. In addition, technology will be used to conduct parts of our evaluation requirements. Evaluation throughout the program help us to make changes in midstream. How will we determine success? The baseline group is our nephrology nurses. We are implementing these solutions to reduce their workload, which often leads to burnt out, which often causes them to leave Fresenius. Throughout the year, there will be surveys and interviews with open-ended questions conducted. Specifically, within the first 3 months, there will be observations of our baseline group in addition to the patient care technician. Within 6 months, using SurveyMonkey, employees will receive invites and encouraged to complete surveys indicating their thoughts about how the implementation is going. And now that I have concluded my presentation, if there have been any questions or feedback regarding this proposal, I would love to entertain them at this time. Thank you.